And okay, we'll get started here. So welcome everyone. Welcome to the technical assistance session for the RCNAP mid-year submission. Really excited that you are able to join us today. Before we get started, please note this session is being recorded, just like our previous TA session when we rolled out the updated RCNAP guidelines and templates, if you were able to join on that meeting. This recording is for quality assurance and training purposes in case you need a refresher, or if any program directors, clinical coordinators, or health educators were unable to attend today. If you do not wish to be recorded, please feel free to exit the meeting now. We have 45 minutes scheduled for this session, and during this time, we hope to explain in detail the information required to complete your mid-year submission, as well as walk you through completing the different tables and the different templates. At the end of the presentation, there'll be time for Q&A, so we kindly ask that you hold off on all your questions until then. If we run out of time or if you don't get a chance to ask your questions, please feel free to send it to your respective EWC consultant, who will ensure your question is answered and provide you with all the necessary information you need. RCNAP format and template. For the health education team, this is the health education plan template, along with the activities table from Appendix 1, located in the RCNAP evaluation guidelines. If you may recognize this template, as this is the same one you used to submit your initial plan back in July of 2024. If you recall, prior to July 2024, template update that we did, you would complete the RCNAP, work with your EWC consultant on revisions, and then receive an approval email once the document was finalized. The new RCNAP template is now a comprehensive document that consolidates all the various submissions, including the initial RCNAP, the mid-year review, which is the one that we're currently working on now, and the year-end evaluation. Additionally, EWC feedback and approval will be incorporated into this single document for your reference. Also located in Appendix 1 is the template for the clinical coordinators. If you're a CC, this template will look familiar as well, as you have already completed the initial RCNAP. Just like the health education plan template, this is an all-in-one comprehensive document. Small side note, as you know, we recently revamped the RCNAP as part of our ongoing improvement process. We incorporated much of your feedback into the updated RCNAP guidelines and templates. However, if you have any additional comments, please feel free to share them with your EWC consultant. We're always looking to further improve our processes. RCNAP timelines. I want to highlight two important key dates from Appendix 2. February 14th, this is the deadline for submitting your mid-year evaluation. And then, of course, March 1st. On or around this date, your respective EWC consultant will review your submission, provide feedback, and ultimately approve your mid-year plan. Lastly, please note that the mid-year reporting period covers July 1 to December 31st, 2024. Appendix 4, Outreach and In-Reach Activities. This appendix serves as a quick reference guide for both health educators and clinical coordinators to assist with planning activities related to their roles. It includes various ideas for increasing awareness and engagement within your communities, helping you effectively promote key program initiatives. Now let's take a closer look and do a deep dive into the RCNAP templates. We'll walk you through the key sections and details to ensure you have a clear understanding of how to complete them effectively. We'll start with the health education template and tables. Go ahead, Angie.
Thank you, Juan. Good morning, everyone. I will briefly review the health education activities template for mid-year completion. So the main focus for completing the mid-year template is the number of classes, number of participants, and mid-year outreach columns as highlighted on this slide. Number of classes column, this should reflect the total number of classes or one-on-one sessions conducted for each target population. The number of participants, this represents the total number of participants in each target population. If additional populations were involved in a class session, please mention that in the summary section. I understand that some of you track this information separately, but you can also reference CHEER for both the number of classes and participants. Outreach column. This refers to the number of outreach events held outside of classes and one-on-one sessions. I know many of you engage in activities such as networking, collaborating with community-based organizations, attending meetings, and participating in community events. If multiple populations were involved in one of these activities, combine them in one column and provide clarification in the summary section. The purpose of completing these columns is to allow us to compare your data with the progress report that we receive. The information should be consistent, and any discrepancies will be addressed accordingly. This also helps ensure that you are on track to meet your scope of work deliverables. For the health education summary section, please include the following details. Health education activities. Provide an overview of the types of classes conducted, the target population, the county, and any partnerships or collaborations involved. Additionally, include information on the outcomes, accomplishments, and any successes or challenges encountered throughout the process. Example, we conducted 5 classes in Santa Clara County, including 3 classes for the Vietnamese population and 2 for the Cantonese and Chinese population, in collaboration with Cantonese-speaking community-based organizations. We partnered with fill-in-the-blank XYZ organization to host the classes at various locations within their facilities. In total, we reached X amount of participants through these classes and one-on-one sessions. In the summary, please clearly distinguish between the classes and one-on-one sessions. Be sure to highlight key outcomes, successes, challenges, and any other relevant details. In the outreach portion, in this section, please provide a detailed description of each event or activity. Include information about the target population reached and the name of the organization you collaborated with. Outreach activities may include networking, partnering with community-based organizations, attending meetings, and participating in community events. For additional details, please refer to Appendix 4. Be sure to highlight the successes and accomplishments achieved through these efforts. Example, if you held 5 meetings with a specific population, include details such as who you collaborated with, the purpose of the meeting, the outcome, and anything noteworthy you'd like to emphasize. If applicable, you may also include successes or challenges that you submit to me on a quarterly basis. Many of you provide valuable information to me. Please feel free to reference that information in the summary section as well. For the conclusion portion, reflect on your progress towards your goals based on the initial implementation plan, highlighting successes and challenges. Consider strategies to overcome obstacles and enhance outreach in the next 6 months, such as targeting underserved populations, improving engagement, and forming new community partnerships. Focus on strengthening existing relationships, exploring new outreach strategies, and increasing engagement with underrepresented groups, including those with significant health disparities, such as rural or racial ethnic communities. The goal is to increase the visibility of the EWC program, improve the effectiveness of our initiatives, and make progress toward achieving screening and education objectives. Please note that it's important to cover all 3 sections in your summary. I'll now pass it over to Erin to review the clinical portion of the mid-year evaluation template.
Thank you. So in this table, you will only fill in numbers in the columns under mid-year in the gold section where you see the arrows. So the only section left blank in the table at this point will be the year-end columns. And you'll also fill out the mid-year RCNAP report narrative section at the bottom of this slide. This is just a close-up of the table in the previous slide. So you'll just enter in numbers for the mid-year columns in the table. As a reminder, new recruit is the number of new providers enrolled from July through December that address your RCNAP goals. Reactivate is the number of providers in this area who are contacted and retrained on EWC services and enrollment. And TA is all other technical assistance activities not related to reactivating providers. Some examples of TA might include meeting with a clinic and explaining policies and clinical standards or case management. So for the narrative section, you will write a summary of your progress so far toward your RCNAP goals. Some sample questions you may want to address are included here. You can describe how your newly recruited and reactivated providers address the RCNAP goals. For example, do they help reach a certain population or geographic area? You can also describe your technical assistance highlights and use 1 or 2 specific examples of your most successful activities here. Compare the number of activities you've completed so far to the total you planned for the year. Are you on track or ahead or behind? If there are gaps or you feel behind, explain any challenges you have encountered and how you are working to address those challenges. Be sure to highlight any successes you have had in meeting your goals as well. And finally, you can outline your general plan for the next 6 months. And with that, I will hand it back to Juan. Thank you.
Thank you, Erin. Just to recap, RCNAP mid-year evaluation is due February 14th. Please ensure that all sections of the mid-year RCNAP template are fully completed, including any required updates since the initial submission. Make sure your data for the reporting period, July 1 through December 31st, is accurate and up to date. Next, EWC will provide feedback. After your submission, your respected EWC consultant will review the mid-year evaluation. Feedback will include suggestions for improvement, any required revisions, and approval status. EWC feedback is expected on or around March 1st, 2025. And last but not least, RC meetings. Your EWC consultant will be scheduling an RC meeting with you to go over your mid-year submissions. These meetings provide an opportunity to review feedback from EWC and collaborate with you to enhance your plan if necessary. Okay, now we'll open up the floor for any questions that you may have. Looks like we got Shannon. Go ahead, Shannon.
I have a question for you, Erin. On the paper that I have of my approved RCNAP, the column said new enrollments, and now on this one you said recruit. So I thought we were only putting the number we actually enrolled. Could you clarify that, please?
I think it's this. I think it's new enrollment. I think that I'm using the older one.
Okay, I just wanted to double check. Because I was like, I have a provider that I recruited, but then they didn't get enrolled until January. So I was just going to put a note that there were no technically new enrollments, but that the enrollment was initiated and that it's completed during, the next time.
Yep, that makes sense to me.
Okay. All right.
Yeah.
Thanks for clarifying.
Thanks.
Appreciate that.
Okay,
Denise.
thank you, Shannon. Looks like we got Denise with
I'm
a
trying
question.
to uncheck. There we go.
Hi, Erin and Juan. This is Denise. I just had a question about the TA portion. If you are not enrolling any new providers at this time, would that TA portion be blank or NA or 0?
So TA, just to clarify, is not just about enrolling new providers. It can be kind of any outreach that you've done to the clinics or interactions that you've had with the clinics.
So if I've had communication with clinics 50 times, then 50 would be in that slot? With all of my clinics, with all my 89 clinics? Or are
All
you
the
being
clinics
specific?
just on the RCNAP. Can we go back up to the clinical coordinator template, the table there?
So if I don't have any new recruits and I've not reactivated anyone, would my TA column be 0?
So TA is separate from new recruit and reactivate.
Okay, so I guess circling back to my question.
Mm-hmm.
So the TA is regarding all of my clinics and any interactions that I've had with my clinics. So if I've interacted with all of my clinics, let's say a total of 50 times, would that number be there? Or are you being specific to a clinic?
Specific to the clinics that you have to the left, see how there's certain counties and MSSAs and populations?
Yes, I see it.
Yeah, so it's specific to those clinics, not all the clinics in your region.
Okay, so if I did have interaction with those clinics and there was only 5 interactions, then the number 5. If I did not have any interaction with any of those clinics, it would be 0.
Right.
Okay, thank you for clarifying.
Yeah.
Okay, team, any other questions?
I have a question about whether the instructions that you read in this meeting would be available by text anywhere.
After we're done with this TA session, we're going to upload it in the Cheer library, just like the way we did the initial one. And then also we can provide a copy of this PowerPoint presentation deck if it helps as well.
Or just what was read out loud in terms of what should be included, etc.
Let me take that back to the team and let me double check.
Okay. Yeah, just because, the instructions, for instance, for the health educator portion were pretty quick, and I want to make sure that I do it correctly. So if there's any way to have those instructions be written and, something I could refer to, that'd be awesome.
Absolutely. If any questions arise, you're probably not going to have questions right now, or questions are going to arise once you start working in the tables and templates. Remember, we're here to help, so feel free to reach out as well, as we want you to make sure that you submit exactly what we're looking for. Okay, any other questions?
Joy, do you
Okay.
have a question? Joy's hand is up.
I think Joy was.
Yeah,
Joy,
sorry, I was
no worries.
unable to unmute. Can you elaborate what other interactions with the clinics that we supposed to put on the TA? Aside from regarding enrollment, what other interactions are we talking about?
So for example, if you are providing some case management or going over policy, EWC policies with them or clinical standards, detect training, you might have reached out to some of these clinics while you're doing your zero served report. Those are off the top of my head. I can come up with more if you want.
Yeah, that would be nice because we do a lot of interactions with our providers. So we provide all these orientations, not just for case management or policy or DTEC, maybe about EWC programs. So yeah.
Right. So
So
about like if you're reaching out to discuss them meeting or not meeting CPPIs, that's an example of TA.
So CPPI is also included, explaining to them what is CPPI related to their activity, correct?
Exactly. Uh-huh.
Thank you.
Okay, any other questions from the field? Okay, seeing none and hearing none. Again, if you have any additional questions, please be sure to email us. We'll be happy to help you out. And just like we said before, we talked it amongst the team. I think this is one of those exercises that once you start doing the tables and the templates, I would imagine some questions would arise. And if so, please don't hesitate to reach out. Thank you very much, everyone, for your time. I hope you have a great day. Thanks so much.
Thank you.
Thank
you.
you.
Thank you.
Thank you.
Thank you.